Hello, hello. I'm Yuval. I'm a registered social worker and psychotherapist, and today we'll be looking at the relationship between depression and anxiety. What do they have in common? What makes them different? And what are the appropriate treatments for each? Let's start by looking at the overlap that exists between a depressive and an anxious diagnosis. For many practitioners, including myself, it is often the case that these two disorders are on opposite sides of the same coin. They often come together. For example, for people with a depression diagnosis, like major depressive disorder, they often have a comorbid anxiety disorder that happens alongside the episodes, and that rate is 75%, meaning that for about 75% of people who have a depressive episode, they are also going to be having anxiety at the same time. On the flip side, people with an anxiety disorder, such as general anxiety disorder, have an 81% chance of developing a lifelong depressive disorder. Depression can raise anxiety, and anxiety can raise depression. Now, this happens through a few ways. Depression makes someone more emotionally vulnerable and therefore less resilient at the time. And this can therefore increase the negative thoughts that they have. These negative thoughts can then amplify anxieties about real or imagined threats. It is very common for someone in depression to think that other people don't like them. They may then start to think of examples of when they thought they behaved poorly or relationships that ended badly and internalize the reasoning for this outcome. Alternatively, they could at the same time worry about future social interactions. And as a result of this overthinking due to depression, they may develop some social anxiety and not want to see their friends or family because of the belief that they won't like them or that the person experiencing depression won't behave appropriately. That will therefore make them more isolated and just reinforce the depression and the social anxiety. A lot of the mechanisms that we see in depression and anxiety are shared and they reinforce each other. The way I think of depression and anxiety's relationship is one of burnout due to hypervigilance. Someone who really struggles with anxiety is constantly perceiving threats, not necessarily to their physical well being, but to their emotional well being, to their social well being, financial. They will find reasons to worry. And we can only be in that state for so long until we crash. And when they do, that's when depression kicks in and becomes the more dominant way of being. After a while, the depression will start to see threats and hypothetical scenarios where they are not good enough, and they will therefore start to become more worried about things until they re enter that hypervigilant state, constantly assessing for threats, and then they'll burn out into depression again. Aside from the avoidance mechanism of depression and anxiety, they also share rumination. They will obsess in their minds about scenarios that could happen or scenarios that have happened with a very negative perspective. This, therefore, also leads to low self esteem, which is something that people who struggle with both of these conditions share. Both of these states also impact problem solving. So, although somebody who is anxious may be trying to solve problems left and right because of their state, which is physiological as much as it is psychological. They will have cognitive rigidity. They won't be in a creative place to problem solve for the long term or to problem solve well. This also applies for depression. Automatic negative thoughts are not good for effective problem solving. And so, somebody in depression, rather than approach a problem wrongly, may not approach the problem at all due to option paralysis and the lack of confidence that's required to take action. Another similarity between these two states is that they both seem to really benefit from cognitive behavioral therapy as well as mindfulness, and we'll touch more upon this a bit later. Let's look at the emotional and cognitive differences within anxiety and depression. Anxiety is highly reactive. Some new event comes up, the anxious person is very quick to respond and quick to be all riled up about it. Whereas somebody with depression will have a blunted response. So they will respond far less enthusiastically or actively than they usually would. Somebody with anxiety has very quick emotional fluctuation. So they can feel threatened by something and then find relief, and then threatened by something again and then find relief. So it's a very dynamic state to be in. Whereas for depression, there's not a lot that is moving inside, and that leads to emotional inertia. It can take a very long time to switch from one mood to the next. Meanwhile, someone with anxiety is racing from mood to mood because everything is happening so fast for them. That's why people with anxiety often get this sense of urgency that everything must be done now. Unfortunately, this sense of urgency is often based on fear and is often a self inflicted perspective that doesn't often tend to help the anxious person. For depression, there is a lack of urgency, which makes sense considering the blunted response. It is for this reason why it is quite difficult for someone in depression to be motivated to do something or take advantage of a fleeting opportunity because their sense of urgency is quite suppressed. Someone in anxiety is future oriented. They are thinking of these what ifs scenarios, whereas someone in depression oftentimes cannot imagine a good future where they are actively participating in it. And so, because of these two states sharing rumination, the depressive person tends to look at the past and will find reasons why they aren't worthy, they aren't loved, and sometimes that also applies to their present. So, while the anxious person is future oriented, the depressive person is more past oriented while also being able to look at the present in the negative light that is shaping their thoughts. For the anxious person, the world is full of threats, and this can be a horrible hamster wheel to be on because the anxious person just goes from one threat to another without stopping. And when they do stop, it's often due to burnout, and that's when they fall into depression. And in that state, the world is not full of threats, the world is just meaningless. So it goes deeper than the threats to the existential realm, and things tend to move slower over there. And so the threat perception that the anxious person faces is playing a very different game when the person is depressed. They aren't worried about this exam or this event. They are worried about their life having no meaning, that there's no meaning behind the exam or this social event. It's just empty. And because of that, the person in depression often feels hopeless, while the anxious person tries to control the threats around them. This need for control is a large component within anxiety, where the anxious person grabs too tightly, the depressed person lets go perhaps too much. And it's really about finding a balance between these two states that leads to good health. And I think we'll see that in the next part, where we talk about the physiological and behavioral differences of these two states. What we are looking at is the difference between overactive and underactive stimulation systems. For example, someone with anxiety has increased arousal in the body, so their heart rate is going a lot quicker, their blood pressure tends to be higher, and as a result, they are sweating more. Whereas somebody in depression will have the opposite. They will have a lower heart rate and usually lower blood pressure as well. Somebody with anxiety is overstimulating themselves through their worries and actions to the point where they have stomach aches and headaches. It's not uncommon for somebody with anxiety to feel nauseous. They are overstimulating their system, and that can be a result. Whereas for someone with depression, we don't generally see issues due to overstimulation. What we see is just a general pain, usually muscle related, that is experienced during the depressive episode. Somebody with anxiety may be very restless. They may be very fidgety. They have to get up, move around, and then come back a lot. Whereas somebody with depression tends to move a lot slower than usual. Being in the mental health field, if you know someone's baseline, you can tell if they are in a depressive state based on how quickly they are walking. Likewise, speech is similarly affected. Someone in depression will have very slowed speech, while it's the opposite for someone in anxiety. They may be speaking so fast, moving from one topic to another. In terms of the behavioral front, someone who is anxious is very much active in their life, though they are incredibly worried about things to come. But for people in depression, they face reduced participation in life and the much more passive. So you see what I mean about this balance. The depressive person is too passive, while the anxious person may be too active. And somewhere in the middle is where well being flourishes. The person in anxiety struggles with analysis paralysis. So they are trying to figure out the solutions to these many problems that they are perceiving. And they're stuck. There are too many options and they don't know which way to go. On the other hand, for someone with depression, they don't have the motivation or interest to go or even think about the threats that an anxious person is perceiving. For someone in anxiety, their symptoms can fluctuate quite rapidly. And I mean this in terms of their ability to function. They can function very well and then have a few hours of not being able to function due to being overstressed. And then that could repeat, or the times can change. But there are times when the person with severe anxiety can function and cannot, and it's often a dance between those two. Whereas for someone with depression, they will face their symptoms for longer durations. Because of the slowness of depression, it often comes gradually. Now, there are cases where that's not true. For example, if somebody lost their job, lost their partner, bad life circumstances can lead to a very quick depression. But when we're talking about mental illness and episodes that form on their own, perhaps with some kind of pattern that is unrelated to external circumstances, we generally see a slower development of the depressive episode. On the other hand, for anxiety, the trigger for the episode can often be due to a stressful event. And the way that someone with anxiety copes with that is either avoidance or over preparation. You can see this when someone with anxiety is trying to go through a scenario in their head and they are trying to think of every possible option that the scenario can go in. They will then not feel comfortable until they thought of every possible scenario that could arise because they want to be prepared. Meanwhile, someone in depression will simply not want to engage with that scenario because they are more withdrawn. Again, you can see the need for balance here. The person who is in depression wants to withdraw from life, while the person in anxiety is trying to figure out life to the point of such extreme pathological over preparation that they never actually start to engage in life in a wholesome and calm way. Somewhere between these two states is health. In terms of how it feels from a temporal standpoint, for anxiety, everything feels immediate. There's this immediate threat and then this immediate threat, and you're jumping from one threat to another. While for someone in depression, the state can feel endless. A week in a depressive state can feel like months, and it feels as if there's no end to it, that this is how it's going to be from now on. It's a horrible way to live, but fortunately, there are treatments for both conditions. As we said earlier, cognitive behavioral therapy, or CBT, is very effective for both anxiety and depression. It's kind of the gold standard for them. And there are a minority of people who CBT doesn't work for. And that's when ACT comes in, acceptance and commitment therapy. CBT tends to work better for people who are more analytic, while ACT is better for people who are more on the emotional side of things, who engage in emotional processing to help themselves get out of bad states that they find themselves in. I practice both with my clients, and also mindfulness is another tool that both people with anxiety and depression can use. Interpersonal therapy is an interesting one because I usually use that for my clients with bipolar disorder, but I've also found it to be really successful for people with anxiety disorders and depressive disorders. However, the focus of the interpersonal therapy differs. So, for people with anxiety, the trigger is what we focus on. For example, if someone with anxiety gets triggered by their mom, for example, this is what we will focus on. Whereas for people with depression, the more abstract aspects of interpersonal therapy is what we focus on. So this can be grief, role transitions, and sometimes conflict, depending on what sparked the depression. Both anxiety and depression can benefit from exercise. However, the purpose of the exercise needs to be different. For people with anxiety, the exercise should be about calming the system down. So, this may involve more stretch based exercises rather than exercises that get your heart up, which is what people in depression really should do. And the reason for this is we are now trying to mimic the opposite physiology between anxiety and depression. I can tell you, as someone with bipolar 1 disorder, that the physiology between mania and depression is as real as it is extreme. And I would also argue that mania has a lot in common with anxiety from a physiological standpoint. The difference is really in the psychological. The threats that an anxious person will perceive are opportunities in the eyes of someone who's manic. But a lot of the physiological traits are very similar, including nausea. I know that when my manic episodes went on for too long, I would get incredibly nauseous. And so, again, somewhere between depression and mania is health. You don't want your body being overactive and you don't want it being underactive. Because we want the body of someone with anxiety to reduce activity, we often incorporate breathing and relaxation exercises into the treatment. Likewise, we want the person with depression to be more active. And so we engage in behavioral activation techniques that will get them to go to the gym, to raise their heart rate, and to reconnect with the world around them. And so that is some of how depression and anxiety are treated. If you're struggling with depression or anxiety and you haven't found a good practitioner or program that fits your needs, you can book a free 20-minute consultation on my website. I will leave the link below. I really hope this has been helpful. Bye for now.